contagious Omicron subvariant are rising and is now the dominant strain in the United States. Right now, we're joined by Dr. Jeffrey Potoff from UW Health. So, doctor, what do we know about this BA2 subvariant?
Yeah, so we know about this subvariant that is largely similar to Omicron in many ways, except for it's a fair bit more contagious than Omicron, which means, close encounters with individuals who have it, if you're not protected, it's really easy to catch it.
And so I've seen a couple reports from some health officials also saying that they're watching this South African subvariant, which makes COVID more infective and more severe. Is it likely that we will see continuous waves coming through?
I think we'll continue to see different variants of COVID-19, and some of them will develop into being a big deal, like Delta or Omicron, and others will fall beside the wayside, know that they just, weren't able to take root. But I do think, just like we have different strains of influenza every year, we're going to see different strains of COVID-19 as we go forward.
Dr. Potoff, this is something that we've talked about for quite some time here, ivermectin. And there's a new study here that actually debunked this medicine.
Yeah, I would say it just kind of collaborated what other studies had shown that, ivermectin taken for COVID-19 really doesn't do anything to help you out. This is a larger study than we've had before that really shows taking ivermectin is probably not worth it. And you only have the harms of taking the medication, no benefits against COVID-19.
Now, when it comes to people who are fully vaccinated, are you concerned that with this potential new booster, with this fourth vaccine, some people who feel like they are protected are going to bypass this booster?
I think it's a possibility. Every time we have another booster, the incremental benefit isn't quite as large. Now, this last booster dose that was approved for those over the age of 50, based on some data from Israel, it likely does decrease pretty significantly your risk of severe disease. If you come in contact with Omicron, doesn't necessarily significantly prevent you from getting any symptoms at all, but does give you that assurance of not getting severe disease. But as we go on, I think folks are getting somewhat fatigued. We still have a large group of the population that hasn't gotten their first booster. That worries me actually more than even those folks getting the second booster.
And when we're talking about vaccines in children, with this new study that says Omicron, did a good job avoiding vaccines, but still prevented those worst systems. What can you tell parents in terms of getting their kids vaccinated?
Yeah, this is actually what we would expect. So Omicron is different enough from the original virus that those who are vaccinated, boosted, it's still possible that you'll come down with symptoms. That was less likely early on in the pandemic. This study shows the same things for these childhood vaccines. Children may come down with symptoms, but those symptoms will almost certainly be mild, and they won't be counted among some of those children who, prior to being vaccinated, would sometimes come down with really severe disease. So that's the real benefit of the vaccines. I'd encourage parents to get their kids vaccinated so they can go to bed at night and not worry that if their kid gets COVID-19, whether or not that's going to be a trip to a children's hospital, kind of that nightmare story, or whether it's just going to be an inconvenience of something more like the flu or the cold.
All right, Dr. Jeffrey Potoff joining us live. Thank you.